As autism spectrum disorders continue to be undiscussed, experts are shifting focus on ways to address the challenges with emphasis on policy dialogue. A roundtable talks, which took place in Lagos, brought together healthcare professionals, policymakers and financial executives to address the integration of autism screening into the primary healthcare framework of Nigeria and the development of sustainable financing models for post-diagnosis care. ASD is a neurodevelopmental condition characterized by challenges with social interaction, communication, and restricted or repetitive behaviors. Medical practitioners are now calling on government to bridge the infrastructure gaps for formal diagnosis.
This is not a conference. It's about how we show up. And it's not about how we show up in the April Awareness Month. It's how we show up every day. And how we show up every day is important because that's what's going to make the difference, not just when you show up for the month. I've started training some of the people that are important to this journey, that help to relieve the burden of autism on the various stakeholders, from the home to the schools, to the physicians.
There's appropriate response for every stimulus, and you see that you're not getting that appropriate stimulus. It's rather, like I want to describe, everybody's going right, you're going left, and all that, So that is when you should seek help, that this child is not behaving like the other children that I know and I've trained and brought up with.
We need to come together, collaborate. In the areas where you are strong, where you are weak, I can come in. In the areas where I'm weak, you can come in, to support one and also support the government. The government needs to recognize that we exist to be able to give us the right support. They say, oh, we don't know who is the right person. How do you know if you don't go into the field to look for the right set of people to support? When they come in and support, then we can now transfer that support to the parents.
To ensure that the policies are implemented as they were designed to be implemented, because I believe that the policies that we currently have are Nigerian-owned, they are curated for Nigerians, and therefore once these policies can be implemented as they were designed to, we will have better results in the management from end to end about the challenge that we'll talk about today, which is autism.